Hello everyone, my name is Nimit and I'm one of the Salesforce Trailblazer and I'm currently working as a senior solution engineer for Salesforce practice, right? And I have been working on several clouds, right? Sales, service, marketing, right? Education as well. But the most important is about the health cloud, which is main, and people should know this very, clearly. Right, I'll start with the basics. Right, probably I've onboarded many of the clients all across an India region, right? But yeah, you should know that, and every B2B firms, companies or hospitals or healthcare hospitals should also, start using or knowing Health Cloud, right? Which is the most important thing. So I'll just go with the theoretical part, right? So here we'll be discussing about the implementation of Salesforce Health Cloud for improved patient and clinical experience, right? So yeah, introduction means, right, we say Salesforce Health Cloud is an industry product built specifically for healthcare. That's true. The core capabilities of Salesforce Health Cloud is number one, it says Health Cloud provides necessary data model to help unlock data from legacy systems of records and EHRs, electronic health registries, right? I also will explain in the other slide. In the next slide, I'll explain you about what is EHR. Just give you an example, right? So moving on to the second point is that it gives healthcare professionals the tools they need to collaborate more efficiently. The third is healthcare coordinators understand patients more deeply and build one-to-one relationships across entire care journeys. Health Cloud provides essential functionality for payers. Payers means like insurance companies, right? So now the terminologies of Health Cloud, right? So one is the first is the care team. Care team means like doctors, healthcare advisors, nurse, therapists, administrative professionals. In Salesforce, healthcare team is usually case teams, right? We call it case teams, right? I'll later on I'll show you in the particular demos as well. Providers. A healthcare provider is a person or company that provides a healthcare service, right? Payer. Payer is organization which takes care of financial and operational aspects, which include insurance plans, provide a network of providing healthcare, right? And EHR. So EHR, basically, I would say EHR is more like electronic health registry that holds electronic health records. Just to give an example, like when an EHR is a computerized collection of patients health records. That obviously that includes information like your age, gender, ethnicity, health history, right? Medicines, allergies, immunization status, lab test results, hospitals, discharge instructions and billing informations, and so on, right? These are what EHR stands for, right? And which, and if, later on I'll show you the screenshots, and later on I'll show you the demo, so you will get to know, right, where the EHR falls. HL7. So HL7 means Health Level 7 International is a set of standards, formats, and definition for exchanging and developing electronic health records, EHRs, right? So health cloud feature sets, right? So I have divided into three parts. The first is data privacy and protection and integration, right? And the third is 360-degree view of patient data. And the last is care team productivity. Now, and this is the first part in data privacy and protection and integration. The first thing is that Salesforce Shield provides platform encryption, right? Yeah, it provides encryption as well, and audit trails, event monitoring, hooks for integration to EHR. Right, there might be certain, might be certain software or certain platforms that we can, where it captures the patient's health record. If I talk about the smartwatch, where you capture all your patient monitor or person to person, the health monitor that can be integrated, right? The second thing is a 360-degree view of patient data. That's one is the patient data card, right? Timeline view, patient profile, care team network. And the last is care team productivity. Lead to patient conversations. Sorry, the last is care team productivity. That is lead to patient conversions, care plans, household mappings, require utilize Salesforce CLI to generate them, ability to take assessments using Salesforce service, clinical data model, again, EHR objects, right? So the architecture, the overview of architecture of Health Cloud. Probably I will just explain you. I probably this you have in front of you, right? So when we call it lead accounts, contact person, person account cases, activities, then we have goals and problems like provided by managed package, right? So you can get it download from the App Exchange for the managed package, right? For goals and problems, and even we have Salesforce Shield for PHI compliances. Then we have custom EHR tables that can be built again, provided by the managed package. Payers, member, plan, coverage, benefits, care request drug, care request and other care objects. Customer community for patient. Yes, I will also show you the community portal for the patients as well, how they'll be interacting with the staffs or with the doctors or with any labs or anything. Right. Utilization management unmanaged package. Right. And Salesforce Lightning Console. Yeah, that's true. So this is the data model overview of Salesforce Health Cloud data model for patients, basically, right? Individual data model. So referring to all these blocks, right? I have individual A, individual IDs, referring to individual A with their IDs and all, right? And if you go on the bottom of that, right? So it's a custom object for this, we created for the household. I will also explain you about the household. So guys, you can pause this and you can watch the data module. This would help you, right? Health Cloud data model for care plans. So what says care plan data model that leverages the standard service cloud object. So in for the case we have two record types for care plan and care gap. Then we have case team, case feeds, activities tasks. So obviously in activities task we do have another record type called care plan, right? And knowledge, and we can add two new objects, problems and goals, right? So this is the again, I would say the the model, data model. Again, pause it, understand it, the architecture, and go on. Then we have health insurance data model, memberships, benefits, pre-authorization, and claims. So probably health insurance data model enables customers to gain insight into patients or members' insurance information. This includes membership, benefits, pre-authorization, claims. So if I'm a patient, if I've taken obviously any membership plan or Mediclaim, so if I've added somewhere, so that can be obviously with if that Mediclaim is applicable for that particular hospital where the patient is registered or admitted, if that been applied, so that automatically gets registered over there. Obviously you need to register over there only in the portal, right, in the cloud, and that comes into claims, right? So from there onwards, if you want to apply it, just click that and it get applied if it's approved. Right. So claim objects are moduled as virtual objects. Data continues to reside in the source system, and it's surfaced in Health Cloud in real time. So this is the architecture. So guys, you need to zoom it. It's a little blurred. Okay, just zoom it. It's very important. So now, after talking about the patient, the collaboration and activity, the patient dashboard, how it's look like. So, and if you see example of Charles screen, right, he's in the middle, right, on the left hand side, on probably in this section, this is the particularly the patient details, card details, so medications, everything. So all the informations can be captured over here. You can also mention his score, health score as well using the EHR as well, right? And on the left hand side, obviously, you would find, all the patients as per the task due and dates who are registered over here, who are in the high risk. So if you enter the patient on the drop down, obviously you would see the patient, otherwise you would see another doctors and all. And who you can also sort it on their risk, whether they are high risk diabetes, whether they have any chronic disease or they have any, dialysis, or whatever thing. So you can sort it and you can figure out which in the high, medium, low. Right. So these are the all the information and the between this is the Charles Greens, right? So who are associated with him? If I talk about the external, so in external, so definitely you have his probably this spouse, who's a caregiver, right? And obviously in external, obviously psychologist is there and her daughter, right? These are external. Obviously you can create an external. Internal is something that who is currently taking care of who is currently taking care of this patient inside the hospital, right? So suppose the primary care physician is looking for this patient in the current situation, who's taking care, who's in the counseling part, even this care coordinator, diabetes educator, cardiologist, and many others, right? And insurance coordinator also, right? So this is what it is, the patient. So now this is the health club patient list view. So in this list view, so obviously you can, if you can also create a custom list for patients as well, right over here. So probably you need to use the drop down and my custom list view. All patients are custom with diabetes. So you can create as well a custom list view as well, right? So you can figure out the custom whether you want to put it age on the age I mean you want to do the bifurcation on the age or in the high risk of the patient who are the diabetes sections. You want to show in the diabetes what exactly it is, right? So these are things. Now this is Health Cloud. Patient navigation, right? So in this patient navigation, if you could see on the left hand side, which I have discussed earlier, 2 slides back, this is the patient info, all the info which you could see, related person, right, to him, and motivation, risk level is high, medication, conditions, right, congestive heart failure. So these are something that been, it's called patient card, right, which gets captured, right? And definitely, so if you come in the between of this patient, like Charles Green, so if you see this particular, clinical data. So now the clinical data, as we have discussed about the EHR, what exactly it is. So it records the clinical data. Right. It might be any consultation. So this is the EHR encounter ID. So NCO 0, NCO 1, 10, and so on. Right. So hospital discharge. I mean, about the information, right? Consultation, right? Might be a physiotherapist, might be, might be psychologist, any diabetic, or any lab test is going on for the particular patient, right? Whether he want to go I mean, the doctor has appointed him to go for the lab test, right, or blood test or ultrasound. What exact? So it encounters over here the HR, right? The period starts over here and so on. You can see check over here, right? And the condition is that like about the condition of EHR, basis on that encounter ID of EHR. So it says condition 264, like essential hypertension, moderate chronic, obstructive, right? So it records the result as well, right? Again, if I come down, see observation and EHR care plans. So as if now this patient doesn't have, so it means if you can add it if he has certain plans, care plans, right? So we have certain things like social determinants, accounts, and insurance plans. Obviously, we spoke about the insurance plan, benefits, claims, and also you can add it over here. The patient has, right? Uh, on the top you would see this is what all care plan. So whatever the all care plan, like what the patient has, might be he might have one or two three four, might be insurance plan, medical plan. So you can particularly you can track whether that particular medical claim that is applicable, and what medical claim says which disease can be covered, right? Treatment can be covered. Right. So timeline, it's all again in timeline, I will show you the timeline as well. Household, again, I'll show you the household. Care gaps, probably I'll show you that. Right. On the right hand side, it's called activity and chatter. So in activity, if you click on the activity, right. So you say upcoming overdues. It gives you the all the timeline follow-ups with dietitians and so on, which is the a conversation, or you can say a timeline activity between a patient and the doctors or nurses or might be lab technicians or I mean with the with anyone, might be the billings or so on. So it gets all recorded, right, with the dates and last month and so on, right? So this is all it is. Now, in this, all care plans again, which I told you, the case number, new status, care plan owner, last modified date, and so on, right? So obviously, I mean, the status gets open, right? So probably you could see the owner, Belinda Smith. She's a care coordinator. So probably there's a particular care plan needing taking care of this person. You can also create a new care plan for a patient as well. Insurance plans again, this. member number is added, insurance number, I would say, and group number. So probably on that basis, an hospital, an hospital or healthcare can figure out whether it's applicable for us and which disease has been covered. Treatment, I believe. And this is the timeline. In timelines, obviously, it's something that been scheduled with the doctor or nurses or any staff management for the particular patient. They have scheduled 30 minutes consultations, right? Probably a doctor, suppose a doctor have mentioned a prescription. They have marked a prescription at this time. They need to, they need to have this prescription enter, and the patient hand needs to take that. So this is a particularly called a centralized. If doctor marks any patients, medicines or something or prescriptions or anything, so obviously the care coordinator also, the care coordinator and other people, staff members can figure out using the timeline of this particular patient. They get the notifications and they go to the chemist or pharmacy and they take that and then they, provide them to the patient. Right. So it's their duty. So it is all notified with each other. Okay. Household. Now again, there's a little small flow. Household. So this is the patient, right? You can add household. So you can also add household with the patient, like doctors, nurse, labs technician, etc. Now at this household, if we come down, so household means like, you have the Charles Green household means like, his he's a patient, obviously spouse and son. He can add his family members as well, right? I mean, who are, associated with him in as a blood relationship, right? Yes, and the other household would be like, Charles Green care plans, like main caregiver, care coordination, coordinator, right? Insurance coordinator, PCP, and all. So these are the care plans who is taking care of that particular patient. Related accounts like probably it might be an ambulance or Uber or dedicated car who is taking care of. So I just take an example of Uber. I mean, we have dedicatedly assigned to the patient, Charles Green. Again, related contacts might be other things, lab technicians and so on. We can add it, right? So this is all. And we have all care plans. So here it is, Charles Green. All care plans. It means, I mean, these are the case number. We have registered a new case for this. And the status open here new, and the owner is here, Melinda Smith, care coordinator. She is the created date is this, and obviously here it's mentioned goal. So the goal is open. The state it's grouped by the goal, and it's open. So it means, I mean, the goal is to, like, we need to do a monitor blood glucose level twice a day. I mean, this is a particular goal and that should be completed. So that should convert from open to close, right? This is the goal. So, and again, if suppose you can also assign to other person, then due date, grouping. I mean, problems. Is there any concern problems going on? So you can add the monitor. So the goals is mentioned. If the doctor has mentioned I will lose weight, so in this particular part he needs to lose weight in this second. So that is a particular goal, and when it's completed, so we would record it, created date till the last modified date, because that that gets closed in last modified date. Okay. And again, for the new, when we enter the new case, so probably over here, when we enter, for 1 minute, yeah. So when we enter a new case so when we enter a new case, the first thing is that we need to select a record type for this case. Like it might be care plan, admission, appeal, care gap, complaint. It might be anything, complaint, drug request, right, or any grievances, right, and any service requests. So this case can be registered associated with the obviously with the patient only, right? If there is any patient is causing a trouble, so there's a complaint, right? Any drug request, I have doctors approved it. Again, new case, you need to approve it over here, right? And the second thing, new case care plan. So again, so contact name is this, account name is Charles Green, of definitely additional information, then status in new, then so on, a case origin, case reason. So you need to mention it and you need to save it. So it goes to the, to the particularly the care coordinator or to the lab technicians or to the, a person who takes care of, I mean, the admin part, who does that administrative, right? So he would raise a request to the person to take care of this patient, right? Okay. Or probably a care coordinator only. So, guys, this is the community portal, a community experience cloud that we have developed for the particular patient, right? And this is where, if suppose a doctor needs to chit chat, probably need to communicate with this person, with his patient. So definitely, he would see the on the right hand side, he would see, particular feeds going on that. When a person can't sleep through the night lately and has been walking up in the cold sweats. So this is a concern that a care coordinator would mention. Uh, you know, uh, a care coordinator. We need to tag it to the care coordinator. I mean, probably Shauna Green, her spouse, is marking up and tagging up to the care coordinator over here. Right, about the concern. So over here they can get the reply and so on. So this is the obviously experience cloud that we have developed for that, and team members, member roles, new cases. So obviously there might be cases like main caregiver, right? It might be read only cases, might be a if there would be prescriptions, obviously that would be read read only, right? And open activities like the start exercise. So a care coordinator can also assign a task to to Charles Green or to Shona Green on her behalf, like that. Yes, because Shona Green is the household. So now over here obviously start exercise, evening blood glucose twice a day, sorry, twice, twice on weekly or something. So this is the activities we open. They need to obviously create something. And again, with that we have okay, then we have a activity history, right? So again, whatever the conversation that happened, that will be synced up over here. Okay, this is how it look like. So guys, I'm done for this explaining you about the Salesforce Health Cloud in detail. Probably you would grab that if there would be anything that I'm in the speed or something, right? Because I'm thoroughized with it. So kindly pause the video, understand it, go rewind it and forward it, and try to understand the workflows. The architecture, data model, and all of the Health Cloud is very important. And yes, guys, I would say after this, I would be posting another video, and that would be a demo, a live demo of Salesforce Health Cloud. And also that I'll be explaining about the integration with ChatGPT as well. So guys, keep loving Salesforce Health Cloud. Thank you.